CMC joint for some years when I'm using my hand. Like
At
when
work?
I'm at work and when I'm in the garden and when I'm cooking and something like that.
Okay.
But it's not the whole time, it's just, coming.
It's just coming, so it's
Yeah.
it's occasional.
Yeah, it is.
Okay. But can you relate it to that, like if you do something all day long, then you know you've done it?
Yeah, but not always. Sometimes
Okay.
it's just random.
Okay. And are you right-handed or left-handed?
Right-handed.
Okay. So let's approach her a bit more logically. Now what I'm going to do here is the radial. Okay, I'm on her trapezium and I'm pushing. I have to push really pretty hard with my index finger. She is very stable. What you're seeing moving is skin, not bone, but you can't really appreciate that. Then I'm going to, let's see if we can get you. Okay. Now I've got hold of her first metacarpal and I'm going dorsally. Oh, and she's solid as a rock. Okay, so she has a very stable CMC joint. She does hyperextend her thumb MP. She has what I would say about the normal range of motion. Let's see if she... And that's pretty normal for the MP joint. You'll notice that our first lady really had a lot more than that. Could you tell the difference? You normally have some translation at your MP joint, okay? Her IP joint is stable. And she does hyperextend normally. Okay. You can, don't think about your thumb. Tell me some great secret that I should know.
I don't know.
You don't know a secret? Okay, hold this hand still.
Yeah.
Okay. Okay, now hold it right there. Do not let go of it. Okay, and turn your hand over there. Okay, and now pinch hard. Okay, you can see, yeah, let's get right there. She does not bring her first metacarpal over, does she? I mean, she's really nicely extended at her CMC joint. Can everybody see that? In other words, relax for me now. Let go. Yeah. She does not come over like that. See, she really doesn't have very much CMC. Totally let go of everything. There you go. Let's get rid of that. Okay. That's interesting. She cannot physically go beyond her second metacarpal. That's her passive flexion at the CMC joint. So we know she has this phenomenally stable CMC joint, but what do you see? We really see the same pattern we saw in our previous person, don't we? Where it's really an IP and or an MP matter of collapsing. So the same would be true. Would you be able to change your pattern if you could not hyperextend your IP joint? See if you can slide that on. Is it too little?
Yeah, maybe.
Okay.
No.
You may not get it off.
No.
Okay.
Like
There's
that.
always soaping.
Yeah.
Okay. Now let's do another piece of paper and see what we get. Oh,
I'm not good
wait a
at
minute.
this.
Wait a minute. You need this. She's still wanting to hyperextend. Did you see that? Okay. I'll try
A new
that.
one. Yeah.
Yep, that's fine. Okay, let me just ask you, do you feel stronger?
Yeah, maybe. But it's a bit painful.
Hmm?
It's a bit painful in the CMC joint.
Interesting. And you know why I think it's painful? I think she's loading it more. Don't you think? She stays beautifully abducted. She does not adduct. And she also stays in a great position at her CMC joint. Let's just see if by chance this makes any difference.
I was just wondering whether she was coming down into her outer limits of CMC flexion because you're now putting the IP joint in.
But her outer limits of CMC flexion don't even bring her
Down
over
to
her
close.
second metacarpal. I've never seen this before. You have a unique thumb. Okay, just try this just odd paper here. You've already
Yeah.
started with 4
Yeah.
or 3 layers, yeah. Any difference?
Yeah, it's not painful anymore. Oh, sorry.
Oh, that does make a difference. So and you told me, did you not, am I correct, that you've been doing stabilization exercises?
Yeah, I have.
Yeah, and so can you share with us what you've been doing specifically?
I haven't done it regularly, but I have done. I have done some exercises for my first.
First dorsal?
Yes, and I have done just focusing on keeping this watch when I'm using my thumb, and I'm just trying to like have the control.
Okay.
Yeah.
Well, tell me again when you see. Here's the quandary. It bothers her intermittently. So, what's her motivation, with all due respect, to do anything if it bothers her intermittently? It's very difficult to have the motivational level to wear both of these, for example, and you would need something different here that has more flexion. But it would be very difficult to have her do that for a long enough period of time to really make a big difference. But it would be possible, in my opinion. So here's this great quandary of when is it worth it to an individual to invest what is needed to make a change in the pattern of motion of the thumb? I don't think you're quite there yet. I'm trying to be very honest and very realistic.
Right. Yeah.
You know, you have a busy life.
Yeah.
Your thumb hurts intermittently. So what would cause you to wear this all day, every day, you know, and you can't wear it in the clinic? So this is real. This is life. This is how patients present to you. But the education of what she needs to do to change her pattern, and the fact that I really wasn't sure that putting this on would change her CMC pain, but it did. So I think her CMC is the stiffest CMC I've ever seen. I'm serious. You haven't had an injury of any sort.
No.
It's just very unusual. Let's see if your other thumb is as stiff. No, look at that. Let's get up here so everybody else can see. Sorry. Okay. Look at this. See her loosey-goosey? That's more than skin. That's a little bit bone. And see that? I mean, that's still very secure. But she had none of that on the right side. So why is there a difference in her CMC stability? I don't know the answer to that. But you're very stiff over here. And so it might even be worthwhile to see if some gentle stretching, both in extension and flexion, not to the extreme by any means, but to see if you can get slightly more mobility in your CMC joint. I don't know. That would be pure trial and error. What do you think? Do you think that would be worthwhile for her? She does have, I would bet, more motion over here. See the difference? See how far she comes over? She cannot do that on the right. So no two thumbs are the same. And yet, when we ask her to pinch and tear the paper, she looked very much the same as the first person, right? But she's not, is she? It takes kind of nibbling down the layers. Well, I hope that was a little helpful. Well, I do think this would be the ideal, but it's very hard to replicate. You'd probably need a silver ring, you know, to fit you.